other. Check, check, check one, check two, check. Oh, no, they just let anybody in there now. Did you get to park in the Chandler's lot behind me?
Yeah.
Because I say I drove around the side and I was in the wrong building earlier.
That's where I pulled right behind you.
And I know they're streaming this. We're streaming their stream, so I don't know why I'm sitting out there.
I know, like,
They just don't see me on the camera like that's what it is.
I ain't got no mic stand.
Y'all go up next.
Huh?
Be free.
Yeah.
How many years old?
He's big.
Oh, okay. Are you streaming it too?
I'm streaming his PC.
Yeah, they put out a YouTube stream, we're just copying it.
Don't even try to make sense of it. I gave up a long time ago. I just don't hate you.
How long has it been?
Since March.
I get confused when I read myself.
I think a lot of people do, so that happened to me yesterday.
Dexter told me. Set truck off there. Slash battery counter. Yeah. I don't do set truck anymore. I didn't take it to his. Well, the set truck off, got permission now anyway.
No.
Did you? Galaxy 3, yeah, Galaxy 3 got a quarter. Right before 4th of July. Come on. It's been 7 hours with you that day. You know, we're giving out everything. Yeah. Three, then 3 pop up. That's going on forever. Which I'm glad, because that was the only way I had to.
Check, check, check. Check the mic. 1, 2, 1, 2, 1, 2, 1, 2, 1, 2, 1, 2. Does everybody else have their mics up here or no? Not yet? Okay.
Jason's slow.
Okay.
Hey, you gonna have an extra mic stand with your tray?
An extra mic stand? I'm going to say yes, but I'm also, let me double check something for Lisa Higginbotham. She may have one.
Okay.
Real quick. Okay. Right. 1, 2, 1, 2, 1, 2. 1, 2, 1, 2, 1, 2. Or you gotta just want to, Anywhere in here is fine. You can go either with that or you want it like that. Probably like that. Okay. One. You good? Yeah, there we go. She heard you. Very good.
I just need this space right here.
All three of y'all got together. Let's,
Anybody need a quiet balance?
I know. How you doing? Good to see you. I think right here. Yeah, that's fine. Come on, get up here. Come on, get up here. You're gonna be there. Yes. There we go. Good smiles. Jeff.
Wonderful, thank you.
You want them both, all right? Do y'all have slides of any sort?
I do not.
All right.
I don't think we have slides.
What do you need? Lots are exactly where I needed them.
I just went and messed it up, I'm sorry.
It just helps with the backlight, because it gives really shadow. And since you don't have any slides.
Yep, exactly. Perfect.
Okay, anybody need rock balances?
Sure.
Y'all like stands for those two, I can probably rank them up.
Well, I think they just stand up on their own, it looks like. If that's all right. Will do. Yes. That's for that media. Good. Excellent. Excellent. Good. That's wonderful. All right. Good morning, everybody. I'd like to welcome everyone here today and to thank our faculty and staff here at LSU Health Shreveport who continue to work tirelessly to address the COVID-19 pandemic, as well as experts who are here today to provide updates. We're really fortunate to have Dr. Martha White, who is Director of Region 7, Office of Public Health, Dr. John Van Cherry, who is a Professor of Pediatrics and the Associate Director of the CEVT COVID-19 Strike Team, and then also Dr. Krista Queen, who is the Director of our Viral Genomics and Sequencing Facility. You'll learn a lot about recent updates in COVID-19 as we embark upon a new school year and new events that are happening locally. I also want to thank the media for being here today, and for those of you that are tuning in online, for your efforts to help us keep the community informed throughout this pandemic. And we'll take questions that you have for us today at the end. We're hosting this press conference today to continue to share the latest information regarding COVID-19, which is still a very real pandemic, nearly 2.5 years after being declared a global pandemic. Our expert scientists and researchers here at LSU Health Shreveport, who are world-renowned for their virology expertise, recognized early on the impact that this virus could have and would have, and knew that we could help to position our community as favorably as possible to face this pandemic. Since the early time of the Emerging Viral Threats Labs was created in March of 2020, it's grown to be part of the Center of Excellence for Emerging Viral Threats, which encompasses a testing lab, clinical and basic science COVID-19 and vaccine research, and genomic sequencing and surveillance. Our CEVT team has processed over 680,000 PCR tests, administered more than 120,000 COVID-19 vaccines, and sequenced more than 15,000 SARS-CoV-2 genomes. That is still the highest submitter and sequencer in the state of Louisiana, and has actually, those data have been shared worldwide in international databases. Our speakers will share today more information on what's being seen around the state and in the country in terms of COVID-19 cases, vaccine and testing recommendations and treatments, as well as discussing the variants that are currently circulating and why viral genomic sequencing is important as we continue to battle this virus. So I'd like to introduce Dr. Martha White to the podium.
Thank you, Dr. Kevel. I'm Dr. Martha White. I'm the Medical Director for the Office of Public Health in Region 7. They asked me to come speak today about our local state numbers for COVID. Today, our case count is 1,541 new cases. We had almost 2,500 cases yesterday, so it is varying pretty, a pretty large number each day. So we have been seeing at least 1,500 to up to 3,000 cases a day in the last several weeks. Those cases are primarily the BA.5 variant, and I'll let the doctor talk about that because that's her specialty. In Region 7, which is the northwest corner of the state, we are seeing about 13% of those cases here in our region. We had 6 new deaths yesterday. So people, while everybody says this is, a really mild virus, and it is for most people, we still are losing people every day to COVID. We had 595 people in the hospital yesterday. That's up a little bit. It had dropped to about 505, I think, a couple of days ago, and now we're back up to 595. It goes up and down, of course, as people get admitted and discharged. Only 19 of those are on the ventilator, which is great. And in our region, our numbers are varying from about 130 to 150 per day. We have been higher than that, but we are staying still in our triple digits in this area. So we still have a lot of people who are getting sick enough to have to come into the hospital, to lose that time at work, at home, with their children. And so it does take a toll on our community as well as on ourselves and our bodies. So again, while everybody likes to think this is just a benign virus, it does, for many people it is, and for many people it's not. When I looked at vaccinations, you know, Dr. Van Cherry is the expert on this area because he's vaccinated a large percentage of the state, I think, up here. But we have about 58% of people in the state have taken at least one dose of the vaccine, and about 52% have completed them, the series. That's not enough, and we are low compared to most other states. In our region, we're even lower. For us, completed in our region range from 33% in one parish up to 47%. And for initiated, it's of course a little bit higher. It's 41% in the lowest and up to 47%. So we still have a long way to go. And Dr. Van Cherry and his team, as well as our health units and many physicians' offices, urgent cares, they're still there to vaccinate people. So if you haven't been vaccinated, please consider going to get vaccinated. COVID's not going away. We may see these peaks and valleys for a long time to come, and we want everyone to do everything they can to stay safe, but also keep our community safe. So one of the things that was asked of me is, what is our percent positivity? We have been seeing a decrease in our case counts, like I said, for the last couple of days, with the number of people in the hospital for the last few days. And we've also seen a decrease in the statewide percent positivity. It's down to 24.9%. Last week it was 25.8%. For us, however, we are rising our percent positivity, and that's still with large number of tests being done. So sometimes, you know, people will say, oh, your percent positivity is high just because you're doing just a few number of tests, and those people that are testing are the ones that are the sickest, so that's why your percent positivity is higher. But we're still seeing large number of tests being done, and our percent positivity is staying high. In Caddo-Bossier, in Bossier, the percent positivity is 37%, and in Caddo, it's 41%. So we still have a pretty significant disease burden in our area. And the other thing I wanted to mention real quickly is the incidence. Our incidence across the state is still high. That's over 100 cases per every 100,000. The last recorded one, which will be updated today at 11:30 on our website, the last recorded one was 296 per 100,000. So we still have a significant disease burden in our communities across the state. And as people start coming home, kids start going back to college, start going back to school, you know, we need to be vigilant and aware. And if you're feeling ill, please stay home. If you have to go out, please wear your mask if you're not feeling well. I know people want to say it's just my allergies. Even if you think it may just be your allergies, this is a very contagious virus, and this lady and gentleman can speak to that better than I can, but it's as contagious as measles, which is what we've always known as the most contagious virus. So we don't want you to spread it to other people, as well as we don't want you to get sick. So if you're out and about and you can't social distance, wear your mask. It's just the safest thing to do. If you are not feeling well, stay home. And if you have to go out, definitely wear your mask. And I'll just, again, I'm going to say, please, if you're not up to date on your vaccines, if you even haven't started, it's never too late. Go get your vaccine, and let's try to nip this in the bud finally. I'm going to turn this over to Dr. John Van Cherry, who is like my brother, and he's also the Associate Director for the Center for Emerging Viral Threats. Thank you.
Thank you, Dr. White. So two perspectives that I want to bring. The first is sort of what are we seeing at the national level, and we've been watching the BA.5 variant as it has increased over the past several months. The numbers of positive tests that we're seeing right now are not near what we saw in February, where we had the big spike of the Omicron variant as it arrived in the United States just around Christmas time. So what we're seeing is more of a, instead of a big spike in numbers, we're seeing more of a gradual increase and really a smoldering. Nationwide, there's still about 2,000 deaths per day due to COVID, and those are deaths due to COVID, not of people dying who just happen to have COVID. Those are attributable to COVID. And overall, the number of positives nationwide is again staying fairly flat at a very high level. The amount of testing going on nationwide is actually near the lowest it's been since about May or June of 2020. So we know that there is not a lot of testing that is going on that is reported to the public health databases. That is, most people are using home tests, which is good. They have access to those. You can buy those at the pharmacy. But those results don't get reported to public health. So we think that ratio of the number of tests that are true, the number of positives that are truly out there is about 3 times the numbers that Dr. White cited at any given time because of, again, underreporting due to the rapid tests that are being used. We want to still encourage people to get tested if you're sick. As Dr. White said, it's easy to say, well, this is probably my allergies, or I just have a little headache and a sore throat today. Those are cardinal signs and symptoms that could be COVID, and so we want everyone, again, to be aware and get tested and follow the CDC's guidelines and recommendations for quarantine if you're exposed and isolation if you're truly positive. That's the way to protect the people in your own household, especially the elderly, especially immune-compromised patients, and especially young children. We are still seeing a fair number of young children hospitalized with COVID, especially kids who have underlying conditions like sickle cell anemia, chronic asthma, and other things that predispose them to more severe infection with COVID, or in fact with any respiratory virus. So we know that's part of the picture. What else is circulating around in the community? There are a few other respiratory viruses. We're seeing a little bit of respiratory syncytial virus, other viruses that typically cause colds like parainfluenza viruses, and typical kind of summer cold viruses, but by far and away the vast majority of the cases where we can actually name a pathogen, it's COVID-19. So that tells us, again, a significant amount of COVID activity in the community. As kids get back to school this month, we want to remind parents that this August is National Immunization Month. We want to encourage that kids get updated on all of their vaccines because many kids are behind on routine vaccines, the boosters they need. We want to encourage folks to get up to date for all of their vaccines. When it comes to COVID vaccines for children, they are now available under the emergency use authorization down to age 6 months. The uptake in younger kids has been very, very slow. We're talking only 2, 3 to 5% of kids in the younger age group have initiated COVID vaccine vaccination. So that's what that means is those kids are still very susceptible as they have been throughout this pandemic. And we are seeing, again, more infections in the younger age group as older kids get vaccinated. In that younger age group, 6 months to 5 years of age, and the next younger group, the next older group, 5 years to 11 years, Louisiana ranks 45th and 46th in terms of the number, percent of kids who have initiated those vaccines. So we're way behind the curve across the nation compared to other states in the pediatric vaccine. So we want to really encourage parents to have a discussion with their physician about vaccination of their kids for COVID. It is recommended by the CDC. It will help keep your kids healthy, keep them in school, keep them learning well, allow parents to be at work and not have to miss school to be home with kids. So there are, besides the benefits of reducing the risk of severe disease, there are economic and family benefits to vaccination as well. And we want to highlight those. But again, encourage folks to have a conversation with their primary care provider about those vaccines. If you have any questions, of course, that's your primary source of information. Other things that we're seeing, and I get a lot of questions about, are where are we going with vaccines? And most folks are aware that the 2 companies who have mRNA vaccines, Pfizer and Moderna, have in development and already into human testing what we call a bivalent vaccine, which includes 2 different strains of or variants of COVID-19. So much like every year we have the flu vaccine with 4 different strains of flu, this year in the fall we expect to have a bivalent vaccine that includes the original COVID vaccine strain as well as a variant vaccine targeting BA.5 variant. And again, both companies are working hard to make sure that those are available, hopefully by the end of September, but it could be into October or November. So there are a lot of things that have to happen to make those available. But the expectation is that those will be available. Second thing I get a lot of questions about is what is up to date with your vaccine? And at this stage of the pandemic, up to date means that you've been vaccinated with either 2 doses of mRNA vaccine or 1 dose of Johnson & Johnson, plus having had a booster. So everybody should have had 1 booster by now to be considered up to date. And if you're over age 60, 2 boosters is recommended. If you're younger than 60 and have chronic illness or other conditions that are immune suppressive, then a second booster dose may be available. And again, that's a talk to your doctor situation. Encourage you to have that conversation with your primary care provider. Maintaining and being up to date is critical because, as Dr. White said, just the first 2 doses of vaccine that folks will have gotten now more than a year ago, it has not maintained its protection against severe disease and hospitalization. But it's the booster, and for older folks, the second booster that gets your protection against severe disease back up to where we want it to again, keep people safe, save lives, and keep people out of the hospital. As we approach the fall, things will continue to change. That's one thing that we're certain about with this pandemic. Things will continue to change. But as the new vaccines targeting the variants become available, we will put out as much information as we have available and encourage folks to get those vaccines when appropriate. Third question I get is, when will we have Novavax vaccine available? It has already received FDA approval for use under emergency use authorization as well as CDC recommendation. And the final stages of making that sort of a full green light are that FDA has to finish their certification of the manufacturing processes. And once we have that, we will make Novavax vaccine available. As you know, this is it's a different strategy, a more traditional strategy for making a vaccine, and some people have been really wanting to wait and get the Novavax vaccine. So that could be any day. I expect that at least by the end of the month, that vaccine will be available. We have doses in hand, but we're not allowed to administer those at this point. Last thing I'll highlight is our K-12 testing program, which last year was a very successful program. Caddo Parish is fully enrolled in terms of all of the schools are participating in our K-12 testing program. That benefits all of us in the entire community because that gives us surveillance on a weekly basis about how much activity from COVID is happening in our schools among our young children. And other parishes, some other parishes are participating. We're doing testing down in Lake Charles and Calcasieu Parish, Avoyles Parish, Wynn Parish, Union Parish, Tensaw, Lincoln Parish. So they're kind of spread out by which parishes are interested in doing that testing. But Caddo the Caddo school system is fully engaged in that and provides for us in Northwest Louisiana every week a snapshot of what's happening in terms of COVID activity in our community because of the surveillance of kids. And so we want to encourage parents who have kids in our public school system. If you haven't heard yet from your principal, give them a little nudge. It's okay because the principals have all that information to send out to parents so they can get their kids registered for that program, which has already started this week and will begin in the high schools next week when they start. So with that, I'll pass the baton over to Dr. Queen, who is an expert in viral genomic sequencing. She is an incredible asset for our team, and we're really, really very lucky to have her here in Northwest Louisiana. So, Dr. Queen.
Thank you, Dr. Vanchieri. So the Viral Genomic Surveillance Program here at the Center for Emerging Viral Threats at LSU Health Shreveport continues to be the top resource for SARS-CoV-2 genomic data from the entire state of Louisiana. Our team recently surpassed 15,000 full genome sequences shared with the International Data Sharing Initiative, GISAID. So what this means for our community is that with this level of sequencing activity, we're maintaining a robust picture of variant spread, and we can quickly identify changes and new introductions in our area. Recent data shows that the overwhelming majority, about 3/4 of positive cases, are attributable to the Omicron variant BA.5 and subvariants thereof. We are seeing reduced numbers of the Omicron variant BA.4 compared to previous weeks, and the Omicron variant BA.2, previously called the stealth variant, has dropped down to just a handful of cases in our region. We're closely monitoring the Omicron subvariant BA.4.6 in Northwest Louisiana. This particular variant has raised concern in some regions due to accelerated spread. We've detected several incidences of BA.4.6 in our area beginning in July. While we have continued to detect this particular variant of concern in recent weeks, it is staying at very low levels, and we're keeping an eye on it. Genomic surveillance for SARS-CoV-2 continues to be an important component to the work of the Center for Emerging Viral Threats, and we're onboarding new technology and protocols that will allow us to sequence samples from a number of different viruses more rapidly than ever. And so now I'll turn it back over to Dr. Kevel for the question and answer session.
Thank you, Dr. Queen. Hopefully, I think everybody can see how fortunate we really are in our region to have these three experts here, as well as the whole team that's at LSU Health Shreveport. So I'd like to again thank Drs. White, Vancheri, and Queen for being here. So what's next? I think we've heard today we're certainly not out of the woods yet, and in fact, it's been suggested that it could be years before the COVID-19 pandemic is considered to be endemic. And in fact, even in the New York Times today, they profiled the importance of genomic surveillance and genomic epidemiology to continue to keep a pulse on this pandemic. Our team of scientists and physicians here at LSU Health Shreveport are committed to providing accessible resources and information to address COVID-19 questions and any other future viral threats as may be needed. Last week, the Center for Medical Education building, as many of you know, that's being built outside, will be the new home for the Center for Emerging Viral Threats. And it just recently reached 50% completion. And we're very excited because this new building will provide space and capabilities with a very unique biosafety level 3 laboratory that's designed for top-level viral containment and will really enhance our resources here and ability to address future viral threats in Northwest Louisiana, and in fact, throughout Louisiana and the region. So I'll stop here and open it up for questions for Drs. White, Vancheri, or Queen.
Okay, we had a couple questions come in via social media and online. What are some different symptoms that we're seeing associated with positive COVID-19 cases that haven't been seen in the past? And this might be a Dr. Vancheri question in terms of the different variants that are now circulating.
So this question is related to differences in the symptoms that we're seeing with BA.5 and the current variants that are circulating compared to earlier in the pandemic. A few things are a little different. We're not seeing as many reports of people with loss of taste or smell with the more recent variants. What we are seeing is, with the new variants, a little more lower tract disease, more cough, pneumonias associated with that. Because of pre-existing immunity, now either by vaccine or prior infection, cases tend to be milder, but it's hard to really say the virus itself is milder because of that pre-existing immunity. But a lot of people with COVID now don't have fever, and that's partly because the immune system kicks in fairly quickly to try to control the virus. So that shift is important, because just because you don't have fever doesn't mean you don't have COVID. Is an important part there. The other question I'll answer is, how soon after having COVID can or should you get vaccinated or get a booster dose? And my strong CDC says you can get it within a week or two. My real strong recommendation is it's safe and reasonable to wait 6 to 8 weeks after you recover from COVID, because for some people, having just had COVID mean that the vaccination will give them more side effects. And you're well protected within that 6 to 8 week period after having COVID because your body knows what the current variants are that are circulating. So 6 to 8 weeks is reasonable from my perspective. Okay. Yeah, headache and fatigue are other symptoms that we're hearing a lot of reports about. They're more, it's not specific to the respiratory symptom. And for some people, it's just, I've just had this nagging headache. Maybe it's my sinuses. I, have been fatigued but not had any fever. Those are also, common ways that COVID is presenting in the community, especially those who've been up to date on their vaccines.
Dr. Matrix, probably another question for you. You want to stay up there. Dr. Kettle mentioned, the pandemic eventually becoming endemic, and that we're, that's not going to happen next week or next month or, maybe this year. What requirements have to be met for a pandemic to be considered, for COVID-19 to go endemic versus being considered a pandemic?
So, question is, what criteria will we use to consider consider COVID-19 endemic? And I think that there are a few factors there. It's partly semantics. It's really about the intensity of the infections, the amount of spread in the community that's ongoing. It is related to the establishment of enough immunity in the population to not be seeing frequent deaths due to COVID. All of those factors really weigh in, and that's going to sort of happen in different places at different times because we're chasing the virus sort of as it mutates through this pandemic, but at some point we will have enough protection among as a population that the virus is quelled, is calmed, is not being transmitted, so it's not mutating and not continuing to spread. So it's hard to put an exact estimate on when, but it's not days or weeks, it's not months, it's years before we'll, in retrospect, know, okay, now we're at endemic. It's almost like answering the question, when are we in a recession economically? Well, we don't know until 3 months into the recession, and that sort of thing is appropriate. Okay.
Any questions?
So one thing just to follow up with Dr. Van Cherry's comment about epidemic or being endemic versus pandemic, and in fact, this was talked about in the New York Times article today, and Dr. White mentioned it. For many out there, it's become almost second nature to live with this virus. But there are predictions that it could kill still hundreds of thousands of Americans every year, anywhere between 100,000 to 250,000 per year. So this is by no means over in any way, shape, or form. Yes, and Dr. White's correct. Many individuals suffer from long COVID, and unfortunately, we here at LSU are researching that. Many others across the nation are. But we still don't have a clear picture of what the long-term outcome is with that in individuals that develop it. Any other questions, comments? Yes, ma'am.
So I know before, they were giving tips to not overwhelm hospitals. Is that still a concern now?
Dr. White, I think would be fantastic to have her comment on that.
So we are not, our hospitals right now are not overwhelmed with COVID, but they are overwhelmed because we have a nursing shortage throughout our hospitals. That I think you've seen that discussed in the news many times. So if you need to go to the ER, you need to go to the ER. If it's something that's been ongoing and it's not urgent, emergent, then wait and see your primary care physician. And if you feel like you need to go at night, but it's maybe not an ER visit, try your urgent cares. We don't want people not to seek care, but we want them to try to choose their level of care as succinctly as they can, so that if it's mild, I think I can wait and see my doc, or no, I need to go, but I don't have to go to the ER, think about an urgent care. So we protect our staff, because they are exhausted and they are overwhelmed. Our hospital bed numbers are decreased, but that's based on nursing, a nursing shortage more than we're overwhelmed with COVID patients. Now, we do have a lot of people in the hospital up here from COVID, and it is from COVID, as Dr. Van Cherry said. It's not just someone who happened to have COVID and was admitted for something else. These are people that were admitted with COVID. So, you know, as we get back into school and we watch and see how our numbers do, we may end up in kind of a tight ship on both sides. Hopefully we won't see that, but we do encourage people to take care of themselves, to get good rest, to eat healthy, to exercise, and to do all the things that they know to help keep themselves healthy. Does that make sense? The last number I saw was 138, but I don't know the exact number for today, but it's running 130, 140s. For our region, I'm sorry, for the state, it was what, 595. He remembers better. Anything else? Do y'all want to talk about it? Sure. Do y'all have any questions about monkeypox while we're here? Just FYI.
How much should we be worried about?
So we always say we don't want people to be alarmed, but we want them to be aware and educated. One thing I do want to say about monkeypox is it is not a disease of gay men or bisexual men. It is not an STD. It is a viral disease that happens to, at this moment, have a higher number in that demographic. That's how it started in with this outbreak. But it has spread outside of that demographic in every other state that's further along than we are in the state of Louisiana. Anyone can get monkeypox. So we've seen it in women, in pregnant women, in children, even in infants in this country. So we want people to know what monkeypox is, to be able to recognize it, and if they see that they have a new rash, and it can be as simple as things that look like little pimples, to little ant bites, to chickenpox looking lesions with the blisters, all the way up to larger lesions that kind of have a raised edge with a divot in the center. That's those pictures that you see everywhere, all over the media that kind of scare you. They look horrifying, but they all, whether they're big or small, they can be very painful. They can spread extensively. And the difference with this outbreak that we're seeing is that we are seeing it on the genitals, which I think may be one of the things that's leading people to believe that it's an STD or an STI. The reason why public health put out a lot of information to people who treat people for STIs is that it can look like herpes or syphilis or chancroid, any of those STDs that we see frequently, but we don't want people not to think about it when patients are coming into them. So when we put out a lot of information to physicians to say, hey, if you see something, think about monkeypox, talk to them, see if this could be something you need to test them for, because it is easily spread lesion to lesion with close contact. So it's not the sexual act, it's actually the close contact. It's kissing, hugging, cuddling, sharing food and drink, sharing utensils, and even sometimes sleeping in the same bed, because those lesions, if you have these lesions and they happen to not get covered or they touch the sheets and then you come and lay on those sheets, you could possibly get exposed that way. Same with towels and things like that. So we want people to be aware of what monkeypox is, of what it looks like. Educate yourself, go look at pictures online. And if you see something that makes you concerned, oh, I have this new rash, cover it up and put a mask on and go get a doctor to take a look at it to see if you need to be tested.
How many people are currently hospitalized with monkeypox?
So we don't have anyone hospitalized in this area. We have 2 cases in our area. There are about 90 cases in the state, 88, I believe is the number.
And I'll just add to that to reinforce that, you know, monkeypox is not an emergency. So if you have a new rash, as Dr. White said, you cover it, see your primary care doctor. It's not a middle of the night kind of thing. And from a pediatric perspective, it is a lot like if your child has warts on their fingers or has a rash called molluscum contagiosum, which is little seed warts, they call them, sometimes have a little dimple in them. This is not an emergency. It may be alarming, but it's not an emergency. And typically, the number of lesions is just a few, maybe a dozen, and it's not like chickenpox where you have hundreds of lesions, okay? But it is transmissible on contact surfaces and a very stable virus in the environment. So I think we just, as Dr. White said, need to be prudent about hand hygiene, but not alarmed by the presence of this virus in the community. It is what it is. Yes?
So, monkeypox is airborne as well, it can be transported.
So there is data that early on in the monkeypox infection, when a person is having systemic symptoms, kind of flu-like symptoms, fever, fatigue, maybe a little cough, that it can be airborne. But primarily it's skin-to-skin contact and surface contact. Droplets can also transmit. So it's not an airborne virus like COVID is by any means. And we do want to encourage testing. If you have a lesion that's suspicious, send a picture to your doctor or to your primary care provider by social media or whatever mechanism you have, I guess not social media, but contact your doctor to look at it and then go forward about whether you need further testing there.
Is there a vaccine for monkeypox, and if so, who's eligible for that vaccine right now?
So we do have vaccine in the state. The vaccine has come from the Strategic National Stockpile through CDC into the states. So the health department is the one that holds those doses, or controls those doses. We have two kind of aliquots of it. We have one that is for people who are close contacts of known cases. And then the other group is for people who are in that high-risk demographic, which right now is gay or bisexual men, men who have had multiple, sex partners in the last 2 weeks or anonymous sex partners in the last 2 weeks, as well as any sex worker. So anyone who has performed sex acts for money or for services or goods or whatever, they are high risk. We know that that's not the only demographic, but they are the highest risk demographic. So because we got so few doses, the doses were allocated based on case counts. So the state of Louisiana, compared to other states, had a relatively low number of cases, so we got a relatively low number of doses. As we use those doses, we're getting more in, and then they've just talked, I think people probably saw it on the news yesterday, that they have changed the dosing of the vaccine itself, which increases the number of doses. So you may see that expand to who will be allowed to receive the vaccine right now. Right now, those are the areas that we're focusing on. The one thing I did want to say is this virus is not acting like monkeypox normally acts. So sometimes you don't have that prodrome. So just because you don't have flu-like symptoms, the fever, the headache, the fatigue, the lymphadenopathy, sometimes you just get the rash, and sometimes those things come after the rash. So we want to make sure that you don't say, oh, well, I wasn't sick before, I just have this rash, that you don't think, oh, it still could be monkeypox. It's acting differently in this outbreak than it has previously in the endemic countries that it's come from.
Another question I get about monkeypox frequently is, well, what if I got a smallpox vaccine as a child? Am I protected? And there's still a little bit of a question mark there. The data that's available suggests there is at least partial protection for those who are about over age 50 who would have gotten smallpox vaccine as a child. But anybody younger than that would not have any protection because they didn't get smallpox vaccine. Nonetheless, the vaccine that we have available is effective, is recommended for those in the high-risk groups. It's not currently available for children, and they're not, of course, in the high-risk groups at this point in time.
There is a treatment as well. So for people who have severe cases, there is an antiviral that is in the state, came from the Strategic National Stockpile as well. And that is something that your doctor would request. So if you're having a severe case, especially people who are immunocompromised, sometimes they can get a pretty significant case of monkeypox. Most of the people that we're seeing hospitalized around the country are hospitalized because of pain and for pain control. It can actually get in your mouth, it can get in your eyes, it can get in your ears, so it can cause a lot of problems for people who get a significant rash, especially those that are immunocompromised.
And this is one where a person can actually spread the rash themselves around their body. We call it auto-inoculation. So if you have one rash lesion, you might, rub it or stuff, and then if you rub your eye, you may end up with lesions in your eye or other parts of your body. So that process we know is happening like it does for warts and molluscum contagiosum, other pediatric rashes that we see.
That's why we say keep it covered, so you don't mess with it.
Don't scratch it.
Don't scratch it.
Right, just like
Okay.
Well, thank you all out there and online, as well as the media here. The one thing I'd like to conclude is that if you have any questions or looking for any other information, the latest information and resources that we talked about here today can be found on our website, which is www.lsuhs.edu/COVID-19. So you'll be able to find a lot of information, and if you have questions, you'll be able to ask those questions online as well. So thank you all, and oh, yes, sir.
So you were talking about the or the administrator was talking about the Novavax soon to be available, and I was wondering, since this is a more conventionally created vaccine, does that mean more protection against the vaccine? Will it be a safer option for people looking to get vaccinated?
Yeah, good question.
Yeah, so important question. So the Novavax vaccine, the safety profile is not a whole lot different than the other vaccines we have available. It does have rare cases of side effects like the heart inflammation or myocarditis, similar to other vaccines that we've been using. And but its safety profile is, again, very, very acceptable. Its effectiveness is good, but again, remember, it's based on the original strain of the COVID-19 virus, and it's not an updated vaccine like what we will see in the fall. So a moving target, but I know some people have been waiting just because they were uncomfortable with the idea of an mRNA vaccine, and so we want to encourage those folks to get vaccinated with Novavax if they are not vaccinated yet.
Okay, thank you all again, and thank you to our speakers.